Lumbar puncture. The most common indication of lumbar puncture in pediatrics is to look for CNS infections such as meningitis or encephalitis. You must also ensure that there are no contraindications such as hemodynamic instability, signs of increased intracranial pressure like focal neurologic deficits or decreased level of consciousness and bleeding tendency. Lastly, you must secure an informed consent from the parents or guardians. Landmark is important both for the application of anesthetic and performing lumbar puncture. Identify the iliac crest on each side of the infant. Place one finger on each crest and trace your fingers together across an imaginary line. This will lead you to the site of puncture in the midline at about the level of L3 or L4 below the end of the spinal cord. It might be helpful to hold the finger of your non-dominant hand at the space to mark the spot. This will also allow you to feel if the child is rotating away from you. A sterile environment is a must. You should wear your gown, gloves, and mask. Equipments used are reusable or disposable tray containing drapes, containers, gauze, and the basic instruments and tubes. Tubes must be open before you begin to facilitate filling once you have successfully obtained the cerebrospinal fluid. Open your needle and place it on the tray. Note that there is a stylet within the needle. For infants, you will typically use a 22 gauge 1.5 needle. Positioning of the infant is crucial for a successful lumbar puncture. You must have a good assistant to position and hold the infant. Hold the hips and shoulders, curling the child in a position to open up the interspinous processes. Cleaning of the site should be performed in a circular motion working from the inside out. Clean well beyond the area you will drape with chlorhexidine or betadine. Repeat it 3 times. Place your drapes so as to create an opening through which everything is sterile. Now, it's time to perform the lumbar puncture and obtain the cerebrospinal fluid. Remember that your needle should have a stylet which needs to be in, or else tissue can be pushed into the spinal canal causing a local reaction. Stabilize your dominant hand in the baby's sacrum and aim towards the umbilicus so that you can pass between the spinous processes. If you go perpendicular into the skin, you are much more likely to hit the bone. As you move the needle in, you may or may not feel a change in resistance, often called a pop. If you're not sure if there has been change in resistance, periodically take the stylet out and see if there is CSF flow. If you cannot get flow, put the stylet back in and go a bit further and check periodically. Once you have flow, collect the fluid in 3 to 4 tubes. If you can, get about 1 cm in each tube. Reinsert the stylet, take the needle out and put pressure on the site with gauze. You can dispose the sharps used. Put a band-aid on and tell the patient and advise the family to let the patient remain supine for at least 30 minutes to minimize the potential of post-op headache. Thank you, stay safe, and God bless.